And then the final aspect of what we do in our lab has to do with the fact that diabetics are much more likely to get heart disease. So but they have between a 2 to 10-fold increased risk. So it means they're 2 to 10-fold more likely to get heart disease than somebody who doesn't have diabetes. And we know that there is likely a benefit to having your blood sugar tightly controlled to prevent the development of heart disease, although that's been hard somewhat to prove in studies. But what was very interesting, a recent article, well, it's not too recent, I guess it's 5 years old, showed that patients who were part of this very big trial many years ago that defined how we treat type 1 diabetics, even if they didn't have tight control, so they were initially very tightly controlled, meaning their hemoglobin A1C was very low, they got lots of insulin injections, they had blood sugars that were probably on average less than 140 or 130. Even if you let them not have good control, blood sugars in the 160, 180 range, probably even 200, they still were protected from heart disease. So, and that was after like 15, 20 years of follow-up. So this idea of a metabolic memory has been proposed, and it's actually a pretty fascinating one that we're looking at. And so basically, it tells us that our cells have a memory for their environment. So the cells from the patients who've been tightly controlled remembered that they had had that period of tight control, and that protected them against the development of heart disease later. So we're looking at different factors that might be mediating that effect or causing that effect to happen. And one of the things that we think is this protein, SET79, it's not important for you to know the name, might be acting as a memory mark as certain genes. And so we are looking at that in the context of a lot of different studies. And I just, again, wanted to acknowledge the members of my lab, Dan Moss, Tatsu Kono, Jin-Young Ahn, and that's myself. George has since left and gone to medical school, but he was with us for about a year. And then there's a lot of people in the Diabetes Center, Dr. March's lab, who have helped with that, the one particular study I told you about. And then we have funding from the NIH to do a lot of these studies, as well as some other foundation support. So I'll turn it over to you guys to ask me questions.
We have about 5 minutes.
5 minutes, okay.
I have a question.
Okay.
If you're 6 feet tall, you're taking medication,
Uh-huh.
and all of a sudden you wise up and you try to lose a little weight, you go from 35 to 35,
Uh-huh.
down to 225, and then you get it down to 215. And what I noticed was that I did feel better, and this has been recently, that when I got down to the 215 mark,
Uh-huh.
I felt a lot better. Then I noticed I went up a little bit and hit this recently. I got to back up to 225. I noticed I wasn't feeling too good. Is it possible that if you reduced your weight more, that you can get off of medicine and be cured of
Yes.
diabetes?
It does.
How far would you have to go down in weight?
Well, part of that depends on how long you've had the diabetes.
I've had the diabetes for, I don't know,
25 years. So if you remember that graph that I showed back here, so what we somewhat need to do is we have to catch you in this period before your beta cells suffer sort of an irreversible insult. So there likely is a time where you could completely restore beta cell function, but you have to catch it before the beta cells actually die, because you probably aren't going to get them to replicate enough to take away the insult that they've suffered. So you have to catch them at a point, and a lot of people can reverse their diabetes if you have enough beta cells left.
Is it worth a try?
It's worth a try, because you never know where you are on that curve, and everybody's different.
How long would it take?
Well, I guess,
60 pounds in 2 months she's lost. That's the record.
so that's not typical, and it's certainly great. It's not typical. That's probably faster than most people would do it, and it doesn't need to be that fast. If you just kind of start 5 pounds at a time, I bet you saw that as you lost the weight, you had less and less need for your diabetic medicines.
Right, and I still do, because I was on, what's that thing, I was getting 2 pills in the morning, 2 at night.
Yes, so you're
Well,
lucky, you're still on
and
pills.
I checked my.
Metformin.
But he also takes Actos.
Okay, well that is
All
pioglitazone.
right, what I did, I noticed in the mornings that sometimes I was at 80, sugar count was about 80, so I wouldn't take my medicine.
Right,
And then sometimes at night, the same thing.
and your hemoglobin A1C is what?
In your body mass index,
Uh-huh.
it goes from height.
Yeah.
Is there any relationship at all in age? For example, that, you know, if you're 6 feet tall and you're 15 years of age, is there any relationship between that age as compared to you're 6 feet tall and you're now 70?
It's a little different. These tables are for adults. Children are a little different, so you can't plot them out on these charts easily. They have to kind of be compared on their own growth curves. But you're saying is a person who's the same weight as a 15-year-old, as healthy as a 15-year-old? Who's that weight?
No, what I'm saying is that is there any lessening of the body weight mass or the BMI schedule here?
Well,
Being obese or slightly obese or...
I think that's okay for all adults if you're age 18 or over. What we do know that with aging we lose muscle mass, and that often gets replaced with fat mass, and that's just a normal part of aging that probably has to do with differences in hormones.
George, noticed I did tell her my age.
I have a question.
Okay.
Does your research support the idea that pioglitazone prevents apoptosis of the beta cell?
Yes. We have a lot of research that suggests that pioglitazone is very helpful to the beta cells. Now, pioglitazone and those groups of medicines have been under a lot of controversy because of some concerns about effects in the heart. Pioglitazone, less so. The studies of Avandia have shown that it does lead to some heart attacks. Both of them can cause you to retain fluid, which in some cases is bad.
Yeah, right.
Right. And so what I think that our research would suggest is that there needs to be more than just pioglitazone and Avandia. There need to be smarter designs of drugs that maybe just directly target the beta cell and don't have effects on the other tissues, especially the heart or the kidney, and that would be particularly beneficial to the beta cell and the pancreas and diabetes.
Are you using any stem cells with pancreas?
We use, in the context of type 1 diabetes, we've done some of the stem cell studies.
And how do you turn them on to make insulin?
Well, so that's a good question. So right now we've just been making the animals diabetic, and then we give them these stem cells that we think will prevent the cells from dying further. Now, the question you're asking is, can you take a stem cell and can you make it into a beta cell? And that, I don't do that type of research in my lab. I'm very familiar with it, though, and it's very interesting. So a lot of research has been done using umbilical cord stem cells, embryonic stem cells, fibroblasts. You can take someone's skin cells, you can make it de-differentiate, turn into a stem cell, and then redifferentiate it down a different lineage. And so if you could think about a time where we might be able to take someone's stem cell, turn it into what's called a pluripotent stem cell, where it could divide into any type of stem cell, and then make insulin, that would be great. Unfortunately, when you do those types of experiments, there are still factors that we don't know that are responsible for those final steps of maturation. So you can get them to produce a little bit of insulin, but they need to be put back into the mouse's body before they'll fully cure diabetes. And so that means there are factors that we don't know yet.
Would you clarify something for me?
Sure.
I think I missed it. In a normal pancreas, does it produce insulin at a certain level constantly?
Yes.
And it increases on demand?
Yes, there's always a basal amount of insulin in our body. And then when we eat, a lot of hormones tell the pancreas to put out a big burst.
The other thing, what happened to the herd of diabetic pigs that they had? Did they try to do your thing.
The Ossabal pigs, so Mike Sturek still does a lot of research with them. We've helped and collaborated with him some on looking at some pancreatic markers in his pigs, but we haven't full on done a lot of studies with those pigs. Yep. But it is interesting. We use mice, typically rats, but there is diabetes, or we can make other models become diabetic to look at these things as well.
Are you going to dinner tonight?
I am.
Ellen's going to dinner tonight with us, so we're going to ruin someone's wedding reception if we stay here any longer.
Thank you guys for your attention.